So I'd like to start off by introducing our first speaker, Kerry. So Kerry completed her specialty training in 2019, and prior to joining general practice, she worked in the Canberra Health Services in pediatrics, sexual health, gastro, addiction medicine, emergency, and ENT. She completed her medical degree at ANU and continues to work with ANU Medical School as a clinical senior lecturer and has various roles with the AMA and the RICGP. So her favorite part of medicine is looking after an entire family. So warm welcome for Kerry.
Yuma, is Auntie Vi still here? Oh, she just left. I was just going to say thank you to her for letting me walk, live and practice on their lands. One of the really moving experiences that I've had in advocacy roles was during the marches around the Voice to Parliament. I had the pleasure of walking with Auntie Vi, with her family and mine. And while that vote was not successful, I think it really did highlight the importance of elevating the voices of First Nations people, because I am so ashamed that we still have such an enormous health gap in this country. And I think everyone in the room, if we all are dedicated to trying to address that, we can all make a small difference. So this is one of my favourite subjects to think about. And I want to say thank you so much to the Capital Health Network for putting this together, because this opportunity to talk about what we love about our job is so important. So what does a GP really do? Sometimes people say to me, oh, you're not an average GP, but I would actually argue that in my clinical room, I am a very average GP. Ultimately, we're all about providing that longitudinal care to patients, which really addresses their personal, their medical, their genetic and their environmental needs over time. And we do that in a whole range of ways, which might involve screening, preventative health, those brief interventions, but really looking at that whole person over their whole life. The second answer, which is the other reason why I really love being a GP, is that we have the capacity to shape our careers according to where our clinical skills are, where our knowledge is, our interests, our strengths, and what our community needs. And that is what I really, really love about being that independent GP who works in clinical practice. So I am an advocate, and I'll talk about that a little bit at the end. I'm a clinician who does the cradle to grave medicine, everything from the newborn baby's pregnancy through to palliative care. I'm a collaborator who works with the clinicians within my clinic, but then also people within the broader health system. I am a teacher, but most importantly, I am also a lifelong learner. The breadth of clinical care that I get to do is extraordinary. I might see 20 to 30 patients in a day, depending on the time of year and what kinds of things are coming up, and I do a mix of short, long and quite extended appointments. In the last week, some of the things that I've seen are a little baby who has a rare genetic mutation. He's had 2 cardiac surgeries before he was 1 year old. And as part of seeing him for the first time and going, okay, we've got multiple systems involved in here, and he also needs to be seen by some other people, we organised a referral to a genetic service, and it turns out that both he and other members of his family all carry the same mutation, and there are things that we need to do for everybody. And because I look after the whole family, we can make sure that they all get the right testing. And he's doing really, really well. He'll have his next surgery when he's 14. Every time I see people and I say, what do you do for exercise? And they say, oh, I don't know. And I say, do you run? And they say, no. And I say, not yet. And I prescribe them park run on a regular basis, because it's all just about that social prescribing. And there's a few runners in the room, and if you're not yet. I get to work with people who've got chronic conditions like chronic kidney disease. And as part of that, it's not just about coordinating when are they going to get their dialysis. It's also about coordinating what's pregnancy and fertility going to look like for them. Do we need a dietitian who's got a special interest in kidney disease? How do we make sure that that wraparound care is done? Do they need extra genetic testing? I look after people with chronic pain, PTSD, panic attacks. And this week I had a multidisciplinary call with their psychiatrist to talk about how we manage their psychotropic medications in the context of their cardiovascular disease, and trying to make sure that she's not panicked, but also that she doesn't go into a fatal arrhythmia in the shower. I looked after a mum of 2 with MS, who was one of 3 patients with MS that I saw that day, so I think it was a good day for my medical student to be there to see all the different ways that it presents, and talked about what her sick day plan was going to be because she had a virus that can be a high risk for optic neuritis in her and how we were going to manage that. I inserted a Mirena, took off a couple of skin lesions, did a bit of wound care, did a care plan for a 16-year-old who's got ADHD, autism, binge eating disorder, POTS, and a strong family history of metabolic disease, and how we're going to get her to a place where she feels connected to her clinicians, in control of her eating, and able to manage all of the sensory issues that are associated with her life as she also starts her new job. I did some focused psychological strategies work, which is a long talking therapy appointment with one of my patients whose wife died 2 weeks ago. I was looking after her palliative care. I was with her when she died. I went out, we did the death certificate, and I got to make sure that she had the best possible death on her terms. She was only 60 years old, and the gap that has been left in that family is absolutely ginormous. Because I look after him as well as her, we were able to make sure that during the last 12 months, his caring role was also supported with appropriate activities for his self-care. So he continued to ride his bike, he continued to catch up with his friends and practice his music for his band. So even though she has passed and the hole in his heart is absolutely huge, he still has maintained his social connections because we were able to support him to do that. And finally, I did an end-of-life care plan for one of my older patients. She's 92. She's a bit done with this world. And we have initiated a process of active deprescribing because she wants to go out, sitting at home in her chair, have her daughter pop round in the morning and find her. That's her idea of a good death. And all of this is about knowing your patient, knowing their circumstance, knowing their risk factors, and understanding what their environment looks like and how you can help them live their best life. All of this takes time. None of it can be done for free. And I'm really privileged to work in a clinic which is private billing and gives me the time to support my patients. In all of this, I've had the joy of having a med student in my room 2 days a week at the moment and get to teach her, get to see where her strengths and her weaknesses are, get to finesse her clinical skills, start to introduce her to the horrid long case and what that's going to look like. And it is an absolute joy to have someone in my room questioning, why did you do that? So that I make sure that I keep my medicine up to date. So I teach in clinic, I teach at the ANU when time permits, and I also get to teach at Canberra Hospital. The GP as an advocate, and I really want to highlight that this is one of the great things about being a GP, is that you can have that broad, what we call a portfolio career, where you can do some work for the TGA, you can work full-time in clinic, you can have a VMO position at the hospital, do Justice Health. There are so many spaces, so many boards that you can sit on and so many places to volunteer and give back. In the lead up to the ACT election, I did 42 interviews in 30 days. Trying to advocate for our broader health system, but also a huge proportion of that was about how do we support general practice. We got to meet with politicians from all sides and have a voice about what it actually means to be a GP and to have that one-on-one time between a doctor and a patient that no one else is privy to. And the time warp that happens in clinic where people think they've been in there for 5 minutes and they've been in there for 35. We get to collaborate with the hospital and try and prevent them from implementing policies which I will define in these closed walls as absolutely stupid and will have a significant negative impact on general practice. They might look good on paper, but again, unless you've got someone in there saying, yep, this is something that will really negatively impact on our capacity as GPs, then we need the voices of doctors because otherwise who's going to listen? Great. We have the capacity to provide really, really high quality care to our patients in Canberra and the surrounding region. The very, very last thing that I want to highlight, which is outside of the fact that I absolutely adore my patients and really, really love caring for them, is that I get to work with the most incredible group of colleagues. I get to work in a clinic where The people that have the room next to me are also my friends, and we socialise and we do things together, and we are there for the friendship side. We are there for each other clinically. So when I'm not sure about something, I jump into, Dr. Betty G's office and I say, oh, I'm a little bit stuck here. We form groups where we support each other in some of the tricky parts of medicine, like within medical termination of pregnancy. So Mel Dorrington and I are part of a community of practice where if we run into tricky questions, we put our questions up in a completely safe environment and get feedback from other GPs, gynecologists and people who can support us. We are there to keep each other clinically safe. There's plenty of numbers in my phone, and I spend an awful lot of time calling cardiologists and saying, hey, my patient's got a heart, what do I do next? People, if you reach out and you maintain your networks, you don't have to worry so much about the isolation of being the single doctor in the clinic room. You've got your community around you, it keeps you clinically safe, and it actually makes medicine incredibly rewarding. So if I go back to my foundation story, I became a GP, or I went to medical school because I absolutely loved my GPs. And my mum's GP. So my mum died of metastatic breast cancer and cholangiocarcinoma when she was 48. In the 6 years prior to that, she was cared by the doctors who were working at Watson General Practice. And Dr. Jill Bestick and Dr. Peter Ragg provided her with both clinical care and also with palliative care. And even though she was in she was in Woniassa and he was in Watson, Peter Ragg used to come out and do home visits to my mum when she wasn't well enough to come into clinic. They laid my foundation. They showed me what quality general practice, where they spend time with patients, actually can look like. And while I got into med school and I dabbled with, will I be an ENT surgeon or will I be a gynecologist? And God, I loved endocrine. I kept coming back to the fact that when you love everything, the place for you is generalist medicine. The place for you is where you get to do a little bit of everything according to where your skills and your needs are. And in a moment, I'm going to invite the panel members to come up, and we've got a really great, diverse group of doctors who can help to show you just what different GPs do. Because we don't just do coughs and colds. We do coughs and colds in someone with MS, and we do coughs and colds in a mum who's pretty overwrought because she's got 3 sick kids at home, she's exhausted and she's not coping too well because she's got postnatal depression. Sometimes we do coughs and colds in a little kid who's had 6 hospitalisations because his lungs don't work very well. And we get to do all of that complexity of medicine, and I say we actually make it look really easy. Because what you see on the tip is not what's going on underneath the water. So thank you very much for letting me talk to you about why I absolutely, and I say this sincerely, I absolutely love being a GP. It is the career that I chose, and it's the career that I'm going to keep doing as long as the government doesn't try and break us, for as long as I possibly can.